You might have heard people say that the volume and appearance of semen are the only things that matter when it comes to male fertility. But that's like judging a book by its cover. In reality, there are more than 15 different factors that can be measured in a semen sample. Now, testing can vary in cost from a modest $40 for a basic at-home kit to $1,000 for an advanced diagnostic that dives deep into genetic issues, in the United States at least. Hi, I'm Dr. Vlad, and I'm here to guide you on this journey, helping you save time and money by steering clear of insufficient tests. But first, let's address the elephant in the room. Why is testing male fertility so crucial? The World Health Organization tells us that about 15% of couples around the world struggle to conceive, and the main factor is 25% cases considered as a single, and 25% is combined with women's. So total 50%. It's essential to understand that a man's fertility is just as important as a woman's. And if we don't test a man, it's like trying to find a needle in a haystack blindfolded. We're just making it harder on ourselves to solve the problem. Let's take an example. You and your partner have been trying to conceive for a few months without any luck. So you decide to check your fertility health. You go to Google and search something like fertility test for men. You see various home testing kits with bold titles. But wait just a minute. Most of these kits only measure sperm count. Is that really enough to make your fertility status? Usually no. It's like trying to fix a car with only a wrench in your toolbox. It works for detecting significant problems, but not for everything. If you get concentration of 5 million per milliliter or less, that's definitely a red flag. But there could be various reasons for such a result. The first might be a technical issue, like losing the first portion of ejaculation during collection. Fun fact, the first drops are the most sperm-rich, so they're the most valuable. That's also why unexpected pregnancies can happen, as the first portion can be hard to control. However, low sperm concentration could also signal serious health problems like hormonal imbalances, genetic issues, and more. This can be tough to treat, especially chromosomal issues where you can't change anything. So, in this regard, these tests can be quick and cheap ways to detect severe issues. Some people may think, I don't need any test to see the difference between semen with millions of sperm cells and semen with zero. Well, sperm cells are the smallest in our bodies and make up only 5% of semen portion, which is usually around 2 milliliters. So don't even try to count them unless your name is Clark Kent. But even if you're not Superman, you can help others. Smash the like button and the YouTube algorithm will share this information with more people. Your action matters. Thank you. On the other hand, a low sperm count is only responsible for 27% of male infertility factors. So just having an adequate amount of sperm doesn't guarantee high-quality semen for conception. Unfortunately, basic home kits just don't have the tech to measure all the aspects of semen quality. And by quality, I mean having enough sperm cells with the proper shape, strong motility, and other important factors. Keep in mind, your lifestyle can affect your semen quality over time. So what's the gold standard for male infertility diagnosis? It's semen examination that follows the World Health Organization standards. Why should we trust these standards? Because they're based on data from over 5,000 men across 12 countries like the United States, Australia, France, the United Kingdom, China, and others. All these men achieved natural conception within a year of trying. Now, which parameters should we measure to determine our baby-making chances? We've got semen volume, sperm concentration, and total sperm number. By the way, the total number of sperm cells ejaculated is a more accurate indicator of sperm production capacity. Sperm concentration might stay the same in young and old men, but total sperm numbers can vary due to decreased seminal fluid volume and sperm output as we age. Then we have total motility, progressive motility, non-progressive motility, immotile spermatozoa, vitality, and normal forms of oral morphology. Right now, the 5th centile is considered the lower reference limit for these parameters. What are these centiles about? How to figure out this table? The 5th centile represents the value below which only 5% of 5,000 tested fertile men fall. It means that 95% of tested fertile men had values above this limit. So, for example, 50% of tested men had 3 milliliters of volume, 210 milliliters total sperm that were 55% progressive motile, and 8% of total sperm had perfect morphology. I would say these are pretty rare numbers in real life, and the questions I've been asked many times after that explanation: "Doc, what the hell? Why did they set so large numbers as normal? Only 5% of tested men had these numbers and they decided it's okay?" I had the same questions myself when I started my medical practice as a urologist in a fertility clinic. But then I found that sperm cells have a bunch of other parameters. They can have DNA damage or genetic issues, and they might not function properly when meeting an egg. Not all these factors can be accurately measured, even with today's technologies. But nature, efficient, and every factor counts. Sometimes a small number of high-quality sperm cells can outperform a large group of low-quality ones. Of course, having plenty of sperm cells with high motility and good morphology increases your chances of finding that perfect combination of other parameters. The bottom line is, when you want to get general information about your semen and fertility, you can't rely on just concentration and motility. You need to look at all the parameters and make sure your semen test was developed following the WHO standards. And even then, 100% accuracy isn't guaranteed because many factors still go unchecked. I've seen hundreds of cases where couples come to me with kind of normal semen parameters and no issues from the woman's side, yet they still cannot conceive naturally. The good news is that there are areas you can check and improve upon. With additional diagnostic tests and the right treatment plan, you can create a team of winning sperm cells to boost your chances. Check the description below and find a link to a free tutorial about how to boost your fertility to the moon. In my next video, I'll dive into advanced semen diagnostics and much more. So make sure you're subscribed and join me next time. Until then, stay healthy.